Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Aboelata from Roots Community Health Center, reporting for the week of July 25th, 2022. Today, I will provide a pandemic status update, particularly regarding BA.5, and also discuss our president catching COVID and deaths, as well as a little bit about what is next. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. In Alameda County, still appears that we are in a surge here, somewhere in a surge. Can't tell if we have peaked yet or if we're still in this very high plateau. These last few days will continue to be updated, but we're certainly not coming down, as evidenced here by our 14-day totals. Last week when I reported, we were at 9,870. We're now bumping back up at 10,298. So certainly the wrong direction, or at least, again, kind of this high plateau. Just a brief update on vaccinations of our most recently approved age group, which is our under 5-year-olds, was approved a little over a month ago, and we are just trucking along. In Alameda County, we're at 16% of children 6 months to 4-year-old. And in the United States, we've got over 544,000 little ones who have received also at least one dose of the vaccine thus far. And as it relates to how we're doing nationwide, things really are continuing to go in the wrong direction, speaking specifically on hospitalizations and deaths. So we know that cases are becoming a more and more difficult thing to really assess, given how many home tests are being done. But we can continue to look to hospitalizations and deaths. And unfortunately, those are both increasing. Any given day, we've got about 39,000 people in the hospital. We've got almost 6,000 new admissions per day. This is quite high, and our deaths are also up. We're somewhere around 440 people dying per day in the United States. So this is quite a bit of loss that we're still experiencing due to COVID-19. So definitely have a lot of work to do. When we look here in Alameda County, we can see this. We continue to kind of zigzag a little bit up and down, but not at a good place when it relates to our hospitalizations. It is a little down from last week when we were at 159. Now we're at 146. I think the best news on this particular metric is that the ICU cases are definitely not going up along with hospitalizations in the same way that we've seen in pretty much all of the prior waves. So I believe that's reason for reassurance, because obviously people going to the ICU are considerably sicker. And this is actually a trend that we're also seeing in the nation overall, where hospitalizations are going up, but ICU not quite as steeply. And so I believe that is good news. But again, with over 440 deaths per day in the United States, we're still looking at quite a serious situation. That would be over 150,000 deaths per year if we stay at this rate at this time. But of course, we are all certainly concerned and bracing ourselves for winter, when we anticipate that, like all the prior years that we've been experiencing this pandemic, that the winter surge is quite a bit more devastating than the summertime surge. And we're frankly not doing well in the summertime surge. I think by all accounts, it's concerning to be having this many people be getting this sick, especially when you consider that we have outpatient treatments now. Remember, last summer, we only had one outpatient treatment that was available. That was the monoclonal antibody. A lot of people didn't know about it, didn't know how to access it. Well, this time around, we've got this pill treatment that looks to be reducing hospitalization by 80%, yet we still got a lot of hospitalization. And it's also preventing death, yet we've still got quite a bit of death. So we need to see this data by whether the individuals received outpatient treatment or not. But based on a lot of kind of smaller samples and where we are able to look at this data, it does appear that by and large, the majority of people who are dying are either unvaccinated or untreated or both. So we may have the tools, but the tools are not being implemented in the way that they would need to be implemented in order for us to actually intervene on this level of hospitalization and death. And we know that part of our challenge is that we've got this even more contagious subvariant of Omicron, the BA.5, and this is in the darker green here. And it is about 78% of our cases nationwide. Certainly, this is taking over even more so over here on the West Coast a little bit than some, and in the South than in some of the other areas, as you can see here. But really, it appears that it will just be a matter of time before it completely takes over. And that's, of course, assuming something else does not come along to outcompete BA.5. And so we know that part of the reason that BA.5 is taking off like this is because it is much more likely to kind of get around our prior immunity. We've definitely seen that demonstrated in sufficient studies now, and certainly these patterns underscore this, that it's getting around our prior immunity from even a recent infection, like with a different Omicron subvariant, or from the vaccination as well. The good news is so far the vaccines seem to be holding up well against the more severe outcomes, particularly for those who are up to date and boosted. But in terms of it being able to get around prior immunity and actually cause infections and repeat infections. So we're hearing a lot of people getting infected for the first time, but also people getting infected for the second and third time. And so this obviously brings concern. I don't think we have enough evidence to really report on just yet about whether it's more severe or not. There have been some smaller reports from other regions, but it's getting harder and harder, I think, to really be able to compare variant to variant. And really to be able to say one variant is more severe than others, because we no longer sort of have a good grasp, unfortunately, on a lot of our data. So it's hard for us to say whether this is an unvaccinated person or a person who had COVID and then got the vaccine, or got the vaccine and then got COVID. So there's all these different combinations of prior exposure and infection and vaccination that it makes it very hard to compare things. By the time we have that kind of data, unfortunately, kind of real world population level data, by the time we have that kind of data, it's a little late for us to be doing anything specific about it. And so for now, the most important things that we need to know are what we are able to find out quickly, actually, which is, are our treatments still working? Are our vaccinations still working? And so far, the vaccinations are doing what they are intended to do, which is to stop hospitalization and death. And the treatments so far are all actually hanging in there quite well. And I'll talk a little bit more about that in a moment. And in terms of who is dying currently, we're seeing that in the state of California for the last full week reported that unvaccinated individuals are almost 10 times more likely to die than people who are boosted. And even though that fully vaccinated and that booster sort of line look very, very close together, the gap at this time really is our older folks. So the booster is clearly making a difference in terms of survival rates, particularly for 65 and up. And there's also some evidence that says for 50 and up and those with underlying conditions. And so definitely if you are eligible for that booster, that is what's recommended. And don't think that we're going to see a huge benefit from waiting for a more specific vaccine. And I am going to talk a little bit more about kind of the future and vaccines in just a few moments. And in terms of hospitalization, those who are unvaccinated for that last full week reported in the state of California were 7.1 times more likely to go to the hospital than those who are boosted. So again, very compelling, kind of hard to get around the fact, 10 times more likely to die if you're unvaccinated. That pretty much tells us a lot. Would love to see this data by age group, by whether people received outpatient treatment or not. But I think this would be a good moment to say that, especially if you are unvaccinated and older or in any higher risk groups, you are someone who should be making a plan for outpatient treatment in the event that you catch SARS-CoV-2, because really you are the remaining group that we appear to be losing to COVID. So if you're not vaccinated, I hope that you have a plan for treatment. Please make a plan. And definitely, if you're not vaccinated or you're sort of under vaccinated, you're not up to date on your boosters, let's say you're over 50 and you have underlying conditions, definitely those are situations where we want you to have a plan for treatment. Because at this point, and I know I've said this time and time again, we should not accept any more COVID deaths. This business of having over 400 people dying per day and saying, oh, it's endemic, oh, we can't avoid it, I think is really sickening to me, actually. Over 400 people per day in the United States, over 150,000 people per year in the United States dying from a respiratory contagious virus. It's just really unacceptable, especially when we have vaccines and treatments, and when you add these layers together, they are preventing death. And if we even tried even a little bit to stop it from transmitting, we would not be looking at these type of numbers. So accepting this level of hospitalization and death every single day, it's like, I don't know if we've gotten numb to it or what is going on. But really, this is not somewhere we want to just say, okay, this is how it's going to be. I don't think that we should settle for this because this is quite devastating. And so we should be doing all the things, both in terms of stopping transmission, but also in terms of treating in whichever way makes the most sense. And I'll talk about that in just a moment. So I think I'll go to our president, President Biden. He most likely caught the BA.5, according to his doctor. He caught it. He quickly got on Paxlovid. And I think that I wanted to talk about it because I think it's, maybe an example that we can look at because it's very public. It's all in the news. And I think there's some things that maybe we can learn from it. So President Biden is 79 years old. He has reportedly received all 4 vaccines, so he is up to date for his situation. Remember, the CDC recommends that you get your first booster. Everyone 5 and up get that first booster at least 5 months after the primary series. And then that second booster is for everyone who is 50 and up, as well as those 12 and up with immunocompromised at least 4 months after the first booster. So he's all up to date on that, 79 years old. And his physician decided that he was a candidate for Paxlovid. And I saw some of the headlines. They said, Biden taking Paxlovid for COVID symptoms. Okay, no, he's not taking Paxlovid for COVID symptoms. Remember, we don't wait for symptoms to decide if you take Paxlovid or not. So Paxlovid it reduces symptoms, but that's not why we take it. We take it to not die and to not go to the hospital. It is reducing the risk of hospitalization and death quite significantly. And even though the original studies were in those who are unvaccinated, some of the real world data is definitely demonstrating that it's still having a good effect in terms of preventing severe outcomes. And we want to essentially use it in people that we think are high risk. The list of those conditions from the CDC is in the post. It is a very expansive list, and I think we really do want to be thinking about really anyone who's unvaccinated. Anyone who has underlying medical conditions and anyone over 50, I think are quite, and definitely anyone who's more than one of those things are definitely very strong contenders for Paxlovid. There may be other people where it's in kind of a gray area. That's when you want to talk to your physician and get a plan. And remember, we're going to make this plan ahead of time. We're not waiting till you catch it. So they started President Biden quickly, and that is appropriate. I am very glad to see that we are going with what we know about Paxlovid, the way it was studied in the trial, and also what we know about antivirals in general. You usually do want to start right away. There's really no evidence that waiting is a good idea. In fact, there is evidence to say that if you wait too long, it's just too late and it's not going to help, or it may be too late literally and you're in the hospital receiving inpatient treatment. So he got it started appropriately quickly, and I think that is great. It's a great model for the rest of us. We really want to start within 3 days. The indications say you can go up to 5 days, but any longer than that, we don't want to do that. And so as a reminder, these are the outpatient SARS-CoV-2 treatments. President Biden was evidently on some medications that had to be either reduced or stopped during treatment. That's quite common. So particularly those who have underlying conditions, you may be on medication for those underlying conditions, and it may be one that might interact with the Paxlovid, and so therefore you may need to put it on hold during treatment and for several days after treatment. If you're on a medication that you really cannot stop, or that cannot be done with the Paxlovid, even with those parameters of holding it, etc., remdesivir is also really doing an amazing job of preventing hospitalization and death. And this is actually one of the drugs that we have the longest history with, because it's also been used outpatient really since very early on in the pandemic. And so we have a lot of good data on this. It must be started within the first 7 days. And the good thing with remdesivir, it's for all ages. So if you have a little one with underlying conditions, then this may be a good option. And those treatments work, and we believe will continue to work irrespective of what variant we're talking about, because the way they work, it's not susceptible to any of the changes that have happened in the variants so far, and maybe what we also anticipate going forward. However, the monoclonals are the ones where we have to keep checking with every new variant. Is it still working? Because this is actually giving antibodies. And so this one, the bebtelovimab, is still working against the BA.5. So this is a good option for those who, for whatever reason, let's say maybe severe kidney failure, can't do the Paxlovid and remdesivir, the monoclonal antibody treatment may be a good option. And I'm going to take this opportunity here to say that there's also the monoclonal antibody treatment for those with immune compromise that protects you for 6 months. Not enough people know about it. So sorry that I have to keep repeating it every time, but it's sitting on shelves. People don't know about it. And I'm encountering people quite a bit who are clearly candidates for this. This could really save their lives. Like people after a transplant, people on high dose steroids, people on different medications that may suppress the immune system, people on chemotherapy. These are people who may not mount a good enough response when they get the vaccine. So Evusheld is a monoclonal antibody that can give about 6 months of protection. So really important. Also, I'll mention, if for some reason you are unable to receive the vaccine, and we do have some people who got that first dose, and there is something that really was severe and prevents them from getting it again, or they have a known allergy to one of the ingredients. This is not very common. This is a very rare person that actually cannot receive the vaccine. But if you are one of those people, or you know one of them, please urge them to talk to their physician about Evusheld as well, because if for whatever reason it is not recommended that you receive the vaccine, Evusheld will protect you. So please speak with your physician about this. So back to our president. He was appropriately vaccinated and boosted. He got appropriately and timely treated. They paused his medications accordingly. So all of those are great examples of what to do. But I gotta say, seeing him, this was maybe, the day or two in to his COVID, apparently, reportedly, he's sitting here at his desk working, got a photo op going on here. No mask on his face. I presume there's a photographer in proximity to him. He's got water there, so that's good. We always want to stay very hydrated when we're recovering from or when we're battling really a virus. But this is not the example of what we want to see. If you have COVID infection, can you please rest, relax, do what you're supposed to do when you're sick? Also, you're very contagious. Isolate from others. Check out our prior briefing about how to stop household spread. This pushing through, powering through, working, you're 79 years old, you're behind the desk when you've got COVID. I'm glad the symptoms are mild. I'm really hopeful for a speedy and uneventful recovery, but this is not the behavior that we want modeled. So that's one thing. I think the other thing is not spreading it to other people. I mean, where is President Biden's mask? I don't even see it in the picture here. And frankly, I haven't seen it for a while. And once again, this is not the behavior we want to see modeled. I get it. I understand. He's got great medical care. He's going to get tested all the time. He's going to get treated timely. So he's not, your average individual. But he should be modeling the behavior that we want to see in order to stop the spread of this virus. And so the fact that lately we've seen him not wearing a mask is discouraging, and it's been frustrating to watch, quite honestly. And so I would like to see folks wearing their masks. And yeah, sure, when you get up to the podium, take the mask off. That's completely understandable. You're distanced, you need to be heard and understood. But this effort to push on through, act like we're back to normal, and push through when we're sick, frankly, it's not what we want to see. It's not what we want to do. And it is, in a lot of ways, I think, disregarding of all of the people who have lost their lives to COVID so far, and also to those who are really suffering with long COVID. Because remember, one of the things that we advise is in your time when you have the virus and afterwards is not push yourself too hard. Pace yourself and allow yourself time to recover. And so I get that these are photo ops, but I thought I would use the opportunity to talk about kind of the good and the challenges with what we've seen modeled here in the press, and hopefully we can do better. So there is some hope on the horizon, I think, around the future of our vaccines, because I think this has been a really tough topic and a really tough situation we find ourselves in, where one of the main questions I'm getting right now about the vaccine is, should I wait until there's an Omicron specific vaccine? And I think most are saying, another mRNA vaccine that is more specific to this variant sounds good in theory. And frankly, this was a lot of what we were told when these vaccines first came out, is that, the great advantages, we can just put in a new sequence every time there's a variant. But as we've seen, it's not that straightforward. The process to get it made and then tested and then approved is making it so that we are behind, pretty far behind. So even if we get a BA.5 specific vaccine by the fall, is that going to be the variant we're dealing with? The way things have been going so far, it's really anyone's guess, but it certainly would not be shocking if we were dealing with a different variant altogether. So what do we need to do? And so I don't think that we should give up any hope at all. But I do think we need to rethink, just chasing down each variant does not appear to be sustainable. It's probably financially going to be quite exorbitant. And it's just frankly not giving us the protection that we need. And so we're going to have to look at something else. And so There is a actual summit going on at the White House, and it is a bit overlapping with this briefing, but it is going on much of the day from 11 to 3:30, and that would be, or to 3:15, and that would be Eastern Standard Time. But it looks quite interesting. The link is in the post, and essentially it is going to be talking about some of the next generation of vaccines, which is really, like music to my ears. I really would like to see this focused on, because we saw what was possible when you put billions of dollars into an Operation Warp Speed type of a situation. We had tremendous, amazing innovation and production and all these steps happening simultaneously. And so it's really quite amazing what can be done when we prioritize and resource something. And after those mRNA vaccines were sort of done, everything else feels painstakingly slow since then. So we've got Novavax. Haven't heard when it's going to hit the streets yet, but it has been approved. It is a more, I would say, traditional type of technology that is being used with the Novavax. Looks very promising, even for multiple of our variants. So definitely looking forward to that becoming available, because I know for many people who are not comfortable with the mRNA technology, they were very interested in the Novavax. So hope you all are waiting to hear, and that you will be ready to roll up your sleeve when the Novavax becomes available. But there's some really interesting new technologies that are on the horizon. And I think the two innovations that I've been trying to keep an eye on that I think are probably the most promising, one would be a nasal vaccine, could be nasal or oral, but something that's going to give us some mucosal immunity. So not just putting it in our muscle for us to create antibodies, but really helping us to have some immunity in the nasal mucosa, in the and in the respiratory tract, so that when we encounter SARS-CoV-2, we're actually ready to fight it right away, not having to wait for it to actually work its way further into our body. And I think there's a number of reasons to think that this could work. There's a number of these vaccines in the pipeline. So, and there's a really great article that I linked in the post. It's an editorial, but it does a very good job of going through sort of where we've been, where we are, and what's in the pipeline. So if you're interested in more details, check out that article, and all of its numerous citations is very well cited as well. So I would recommend that if you're interested. But I think that the bottom line is that this is promising. There are reasons to think it will be more effective than what we currently have in our flu nasal vaccine, which kind of sometimes isn't as effective as we'd like it to be, or in this case, as even as effective as the injections. But in this case, there are reasons to believe, and some evidence behind, that these nasal vaccines could really be beneficial. The other innovation that I think could be interesting is what's called a Pansarbicovirus vaccine. So it's basically broader than, it could cover like multiple SARS, and it's broader than just trying to target only SARS-CoV-2 with specific strains. And so it will go much broader than that. And that's one of the other innovations that I'm interested in. So I'll be looking forward to hearing all about what is being discussed in this summit, where we'll have quite a number of prominent people, not only Dr. John, Dr. Fauci, and the usual folks from the government, but also folks from the sort of vaccine development and innovation space, and then also some really well-respected professors and researchers from Yale and other prominent places that will be, I think, shining some light on sort of where we are and where we need to go. And there's sort of an increasing, I think, rallying cry to put as much effort into this as we put into Operation Warp Speed. It got us out of major trouble at the time. preventing the most severe outcomes, and that's great. But this is not going to be the way. Sort of chasing one variant to the next is not going to be the way. And I wanted to kind of put that out there today, because I think folks are getting more and more discouraged. And I actually do think this is hopeful, that we're seeing some progress here, and some attention being paid to how we're going to do this as we move into the future. And hopefully that will give a little bit of reassurance that we're not going to be looking at it every 4-month booster, or or just kind of chasing from one variant to the next. And by the time we get one, the new one is here. I think there's a lot of smart people working on this, and I think we do need some advocacy so that this is something that gets prioritized. But I do see some hope and help on the way. And so in the meantime, I think the two things that I really want to emphasize the most is that we cannot stop with our mitigation measures to try to stop transmission. The reason why we have so many variants that keep on developing is because we're allowing it to spread unchecked. And it is very frustrating and unfortunate that we've done this. And it's really concerning because school's about to be back in session. And if the schools have even less mitigation than what they had last year, which is certainly what it's looking like, without any mask requirements, it's unclear whether there will be vaccine requirements. And I haven't seen any, major HVAC systems installed and so forth. So we're still relying on the same HEPA filtration units and things like that. And then we're seeing that there may even be reduction in isolating for those who do test positive. So it's almost like we've made a policy decision to just let it rip. This is really unfortunate, and in my opinion is actually really unacceptable when we're in a evolving pandemic. I don't want to resign myself to the fact that we're just going to keep letting it transmit, letting it kill, hundreds of people a day, and letting it keep mutating, because the next mutation, we might not be so lucky. Each time is a new opportunity for it to just completely evade our immunity. And that would be kind of a nightmare scenario that is not outside the realm of possibility. So the nightmare scenario I'm talking about is we get a variant that our vaccines are useless against, no longer protect against death. Then we're back to 2020 situation. I don't want to see that happen, but unfortunately, we're really playing Russian roulette here by allowing it to continue to transmit and mutate at this rate. So we need to really get it together. And even though something is not mandated, it doesn't mean we shouldn't do it. And so I think we need to use some common sense here and really show care and concern for one another. This is a collective problem, and only a collective solution is going to help to end it. So please wear a well-fitted filtration mask when you're in indoor settings. So this is going to be your N95, your KN95, or your KF94. Find one that fits you well, and that you can keep on your face, and you're not pulling it down, you're not taking it off to eat or drink, because we're eating and drinking outdoors as much as possible. So outdoor gathering is really always going to be safer than indoors. We do know that there is transmission that can happen outdoors, and that's because a lot of times people are getting too close to one another when they're outside. So you can still transmit it, but really if you're spacing and if you cannot space, then you're putting on your mask. Then it is really so much safer than indoors, because indoors is where the air is just filling up with COVID and you breathe it in. And so if you do have to go indoors, limit your time in there. You're going to wear the high quality filtration mask, but please limit your time indoors. Don't linger too long. And definitely do what you can to improve indoor ventilation. This is opening windows. This is assessing the ventilation systems that you might have. And you can even invest in a CO2 monitor to see how you're doing, because accumulation of CO2 indicates that you don't have good ventilation going on. And so those are the steps that we want to take to stop transmission. The second part is stopping death. We want no more COVID deaths. And this is attainable if we are paying attention and being vigilant. If you're immunocompromised or unable to be vaccinated, talk to your doctor about Evusheld. Get it now. That's protection for 6 months. If you are high risk or you are otherwise at risk of progression to severe illness, you are unvaccinated, ask your doctor if you're in this category. And if you are, please make a treatment plan. Do it now. Don't wait until you catch COVID. It really doesn't matter how you feel when you catch it. You're either eligible for this because of your underlying conditions or lack of vaccination, or you may not be, but that's something you want to find out now. And I'm hearing from people after they catch COVID trying to get Paxlovid, there's still multiple hoops they might have to jump through in order to get it. This is not something you want to do when you're feeling awful. And people are feeling pretty awful when they catch COVID, even if they're vaccinated. So figure this out now when you're feeling well. Do not scramble and wait until it happens. And so on that note, that means if you don't have a primary care doctor, please get one. Get one now. You deserve one. You deserve to know how you're doing on all the things, not just, what would happen if you caught COVID, but how's your sugar? How's your cholesterol? How's everything else? So get yourself a primary care provider, please. Make sure you know how to reach them before you need them for SARS-CoV-2. And still, all this time, getting vaccinated and boosted is providing remarkable protection still, even against the BA.5. Allowing you to survive, even if you catch SARS-CoV-2, keeping you out of the hospital, keeping you from dying. And so please get vaccinated and be up to date on your boosters. And last but definitely not least, maintain a balanced diet, get some exercise, manage your stress levels, consider a multivitamin supplement with vitamin D, and get a good night's sleep. Please, if you have any questions or comments, put them in the comment section, direct message us, or email us at admin@rootsclinic.org. Thank you so much for joining us. See you next Tuesday at 10 a.m.